Hey everyone, my name is Dr. Patrick McGrath and I'm the Chief Clinical Officer for NOCD. NOCD is an online platform for the treatment of obsessive compulsive and related conditions. If you're looking for help for OCD, check us out at nocd.com. That's NOCD.com. We've made some amazing videos and done some partnerships with Nicole Rafiee, and I'm so excited today to be with her and all of you on this channel, answering questions or talking about comments that have been made about OCD. I really think that she's been an inspiration to so many people to talk about OCD openly, and also for an inspiration of people getting into treatment. So thank you, Nicole, for the work you've done, the advocacy that you've done. We appreciate your partnership very much. And it's an honor to be here and to give back a little bit to you and your community as we go through some questions today. But before we get into some of those questions, let me just spend a minute talking about what OCD is so that everybody's on the same page. What is obsessive compulsive disorder? Well, it's really two things. There's obsessions, which are intrusive thoughts and images and urges that people experience, and they wish that they would go away. They may find them to be ego dystonic, as sometimes we refer to it, or things that just don't go along with their own values or morals. And there's this feeling that if I don't do something to neutralize it, potentially something bad might happen. So what do people do? They do compulsions. And what are compulsions? They're either physical or mental behaviors that are done to try to neutralize whatever the thoughts or the images or the urges are, or those obsessions. And because of that, people stay stuck in a rut. They keep doing these things over and over. The compulsion offers a bit of relief, and it may last for a small amount of time. And then guess what? We've got to do it all over again, and then again, and then again. So it turns out compulsions are not a great way to try to manage obsessive compulsive disorder. Now, OCD will tell you I'm a liar and don't listen to me, because OCD wants one thing, and that is for you to do compulsions, because OCD eats compulsions for breakfast, lunch, and dinner. And if you stop doing compulsions, you starve OCD. And if you starve OCD, well, guess what? No more OCD. Why? Because you starved OCD. And OCD does not want that. OCD would like to stick around. OCD would like for you to do compulsions. And therefore, we want OCD to go away. So we want you to do less compulsions. So my job here is to help do lots of things, right? I do these fun podcasts. I do Q&As. I do webinars. But I also help to hire and train our therapists here at NOCD to make sure that they can provide people the evidence-based care that is necessary to help treat obsessive compulsive disorder and related conditions too, because we also work with things like body-focused repetitive behaviors. This is trichotillomania or hair pulling, or excoriation or skin picking. And then there's also tics, and there's hoarding even. And we also do some work with trauma. We do prolonged exposure therapy for that. And we're excited to really try to help people live the lives that they want to live and not the lives that OCD wants them to live. So if you're looking again for help with any of those things and you want to schedule a free 15-minute call with one of our wonderful care team associates, we'd be happy to chat with you to see what NOCD might be able to do for you. So again, go to nocd.com. All right, well, let's get into some Q&A and see where we go. Watermelon says, I don't have a question about anything, but as someone who was recently diagnosed and has been really struggling, I just want to say thank you for being outspoken about your struggles and partnering with groups like this so that people can get help. It means a lot, even if I don't end up using any of the resources. That obviously was directed toward our wonderful, wonderful question asker, Nicole. So thank you, Nicole, again, for doing the work that you do. Here's another one. I've been struggling with horrible, obsessive, intrusive thoughts since middle school and genuinely believed you were a terrible person and disgusting. You started watching the videos that Nicole did, and where she was talking about her experiences with OCD, and what you were saying, or what Nicole was saying, was literally exactly what went in your mind. You realized that you're not alone and felt heard. That's awesome. We love when people really feel heard. That's what we want to see happen. That's one of the reasons we have the NOCD community, actually, because on the community, you can interact with people all over the world who have obsessive compulsive disorder. You can post things on there. You can support each other. You can, again, realize that you are not alone, but there are other people out there in the world who are just like you, who might even share some of the exact same thoughts or images or urges that you have as obsessions, or might actually do some of the exact same compulsions that you do as well. Here's some. Therapy for OCD is awesome. Yep. But don't overlook medication as well. Medication changed your life. So yeah, there's really two treatments of choice for OCD. One is ERP, or exposure and response prevention therapy, and the other is ERP plus medication. The American Psychiatric Association even suggests that those are the two top treatments. Medication alone, less so, right? You get the least amount of results from medication alone, according to that research. But definitely want to have ERP or ERP plus medications as your two treatments of choice. Oh, another question. Any help with dermatillomania, which is another word for excoriation or skin picking. And yes, we do that at NOCD. There's a treatment that we do called habit reversal training. And when you do habit reversal training, you teach people how to deal with those urges of wanting to pick or pull hair, and show people that they can handle those urges without following through on having to pick or pull. So absolutely, there's great help available. I just got diagnosed with ADHD, but every therapist I've ever had has asked about OCD because of the obsessive thought cycles. Could OCD be a comorbidity of ADHD or vice versa? And if so, which causes which? Does it matter how it's treated? It wouldn't be uncommon to see that people could have both. It could absolutely happen that people could have both OCD and ADHD. I think, especially when we're thinking about children, what we can see a lot in children is kids with OCD who are told they have ADHD. And the reason they're told they have ADHD is because maybe they're not paying attention to things the way that all the other kids in school are. Well, you could see how people would just be used to hearing about ADHD and jump to that as this must be what you have. But think about this. Imagine if you're having obsessions and you're doing mental compulsions. No one may know you're doing compulsions because they're mental, because compulsions can be done physically, which is typically what you see in a lot of movies and TV shows and things like that. But they can also be done mentally. And if they're done mentally, well, you might not know that somebody's doing them. So someone might just be sitting there and it looks like they're just sitting there, when in reality, they might be saying a prayer over and over again until they get it just right. So imagine somebody in school is not paying attention in class, but the reason isn't because of ADHD. The reason is because, well, they're doing compulsions, and they're so focused on doing the compulsions that they're not actually paying attention to what's going on in class. Well, that would be a shame, wouldn't it? We don't want to see that happen. And we don't want somebody to be misdiagnosed. We want someone to get the right diagnosis. So it is important, and I'm so happy to hear that therapists have been asking you about OCD, because not all therapists do ask about OCD. And that's one of the reasons why OCD is really the problem that it is, because it doesn't get treatment. It doesn't get recognized. It doesn't show up in claims. Insurance companies don't think they have many people who have OCD on their books. And we want everyone to get the right diagnostic assessment, and we want the right questions asked. So I'm thrilled that your therapists have been asking about OCD. I think that's wonderful. All right. Someone says, I'm moving to the U.S. on a student visa and was wondering how difficult it would be to get diagnosed as a foreign national. Well, not difficult. You have the right to use any of the services here in the U.S. And if you have insurance, it will likely pay for it. And there's also cash pay options for people too. So I would, once you get here, definitely check that out. But NOCD has worked with students and people from other countries who have been here and seen them in the past. So I haven't seen an issue with that at all. All right. NOCD changed my life for real. I've been with my therapist for 3.5 years now. It is the best thing you've ever done for yourself. Well, the Zinger 14, thank you. That's awesome. So happy to hear that and really pleased and thank your therapist for me too, for all the great work that they've been doing. That's absolutely wonderful. All right, let's see. Next question. How to deal with OCD without medication or going to therapy? Now, I'm not sure why you aren't on medication or going to therapy. I don't see anything in there about that at the moment. Maybe it's because people can't afford it. Maybe it is a fear of getting diagnosed. Maybe it's a fear of telling people about intimate things about yourself, or that, what if you get reported or something like that? I want to deal with that a little bit. Many themes in OCD are quite taboo, and many people then can worry about, well, if I tell somebody about these things, that will be absolutely terrible. I mean, they could have me arrested. They could have me thrown in jail. And an OCD therapist is going to know what's the difference between a pedophilic OCD theme, say, and a person who actually wants to go out and harm children. So I would encourage you to still reach out to somebody who is an OCD specialist to talk about these themes of maybe more taboo nature, because we really do know how to help you with that, and we know what we're doing to treat it. All right. I'd love to know more about intrusive thoughts in OCD because I feel so much guilt. I'm glad you brought up guilt, actually. So the Diagnostic and Statistical Manual of Mental Health Disorders, or the DSM-5 TR, the 5th edition text revision, states OCD is about, anxiety and distress. But it's more than that. It's also shame and guilt and disgust. OCD will use any emotion that it possibly can to get somebody to do compulsions. Okay. I want to make that very, very clear. OCD will use absolutely any emotion that it can to get somebody to do compulsions. So if OCD can lead you to feel guilty and that will get you to do compulsion, you're going to feel guilt. If it's shame, you're going to feel shame. That's just the way that OCD works. And I encourage you to reach out to somebody who can assist you with that, so that, again, you don't have to live the life that OCD wants you to live. You can live the life that you want to live. Because the life that OCD wants you to live is a very simple but terrible life. And that life is this: do more compulsions. That's the life of OCD. Do more compulsions. Who wants that life? It sounds absolutely terrible to me. I would not like it whatsoever. Let's see. Sage says, I don't personally have OCD, but my sister does. What is the best way you can support someone with OCD? Great question. Number one, you can always offer to attend a therapy session so that you can work with the therapist and get some advice from them. One of the things that I talk about is, as much as your sister may want to have you participate in safety behaviors, eventually you're going to have to pull away from those. You don't have to just, cold turkey everything right now, but eventually you will have to be able to step away and watch your sister be uncomfortable without doing something to try to make her comfortable. So if your sister is begging you to promise her that she'll be fine and everything will be okay and nothing bad will happen to her, I know how tempting that might be to give her the, I promise you, you will be fine. There's nothing to worry about. But that just simply is not good advice. That does not really work. And the reason that doesn't work is because you've probably done that for maybe even years already. And I don't think that you've seen that it's ever convinced your sister that things will be fine and everything will be okay. I bet your sister has done what I call the OCD lie as well, which is, this is the last time, I promise I won't ask you this again, but could you just one more time assure me, or something like that? Well, you've probably heard that 1,000 times too. As difficult as it is for family members to be supportive of somebody going through OCD treatment, the best support you can provide somebody who is going through OCD treatment is not providing them safety behaviors, because If safety behaviors actually worked, people with OCD wouldn't need therapy because they're constantly doing safety behaviors, the biggest one being compulsions. So we don't want that to happen, right? We don't want more compulsions. We want less compulsions. And that becomes the goal of treatment. So whatever you can do to eventually be aligned with your sister, supportive of your sister, but not giving in to your sister's OCD, that's when you're going to do the best help for your sister. Is it possible I had undiagnosed OCD when I was younger, but I got over it? Well, you may have had OCD. You may still have OCD. It may be more on a mild case, or it may just be about something very specific. Or could it be a phobia and maybe it isn't or wasn't OCD? It was about one thing. And maybe instead of compulsions, there were other safety behaviors like avoidance or reassurance or distraction. So it's hard to give you a definitive answer at the moment because, well, we didn't have a diagnostic evaluation. But I would lean more potentially on the phobia side. I have not seen in my practice where people, will talk about, oh, I had OCD as a kid and then it went away for all this time and then it came back. I just haven't seen that. Now, maybe I haven't seen it because if they had it and then it did go away, they never came back for treatment. But I don't see even in research findings that we have found things like that happened as well. So I just would be wary of the notion that OCD would be something that would be there and then just disappear. I would find that odd. I'm not saying that something like that could never happen. I just find it would be strange to hear about. Frog Time says, my thoughts run my entire life and I relate a lot to OCD symptoms, but not all. I've already been diagnosed with anxiety, but was wondering if there's many similarities between OCD and anxiety. Well, OCD used to be listed as an anxiety disorder up until DSM-5. OCD can absolutely be fueled by anxiety. And I've often said that the anxiety disorders and OCD share something in common, which is the what if condition. Both are what if disorders. Like, what if I have a panic attack? What if I'm judged or evaluated? What if I do this terrible thing and then something bad happens to somebody? All these what if kinds of things. So they do definitely share a lot together in those types of things. You say for you, it feels like your issues aren't just explained by being anxious, but you don't want to go around saying, I think you have something when I don't. Another thought that runs my life. Thank you. It's that one. Yeah. Thank you for being outspoken about this. Awesome. So here's what I would say. Never hurts to reach out to get a second opinion, another diagnosis to see if it is OCD, or if you really do trust your therapist, bring up OCD to your therapist and see if maybe that's what's going on. And maybe that you two can walk through the diagnostic experience together. Next, we have, my question would be about relationship OCD. Unfortunately for me at 15, when I got help, it wasn't really a thing and you suffered with it, but now you're older and it's really bad and it makes you feel constantly like you need to confess for everything you do. How do you recommend talking to a partner about these things without it seeming bad, like the links or the books that you can send? You're right about relationship OCD being on the newer side. Even when I wrote my book, the OCD Answer book, relationship OCD wasn't a thing. And that was, I believe, 2008. And we weren't even looking at it then as being a subtype. We've come around. So that's the beauty to me of OCD work too. We acknowledge when we've missed something, right? And we can do better. And that's what we've done. So now I would change a few things in the book, actually, or do a couple of more answers about it than I did. But in terms of relationship OCD and a partner, again, if you're in therapy, I think it's a great opportunity to bring your partner into the therapy session to work with the therapist. And the two of you as a dyad can work with the therapist to learn about how to be supported and how your partner can support you through this experience. And yes, maybe some of the things you will say would be a bit triggering to a partner. right? And when they hear about some of the things that come up in relationship OCD. And that's again why I think that it's helpful to have the therapist there so that the therapist can assure your partner, by the way, these are very common themes of relationship OCD. So that we're not here to take this personally, but this is just the way that relationship OCD works. I think that that could be a really helpful thing. Is it common to have severe fears of death or dying, specifically dying in your sleep or leaving people alone for too long and having the fear that they are dead? Sorry if this is dark or too much. Well, it's not dark or too much. There's no such thing as too dark or too much for OCD. In fact, OCD loves dark and a lot and much and all of those things. And this would not be an uncommon fear in obsessive compulsive disorder where people be afraid of what if they were to die or what if somebody else is dead, because I haven't heard from them in quite a while. And the compulsions would be, of course, along the lines of what can I do to assure myself that I'm not going to die in my sleep or that someone else isn't dead. Now, it's much easier to find out if someone else is dead or not, right? You can call them, you can text them. Of course, if you don't get an answer from them right away, OCD jumps to the worst case scenario, which is, oh my God, they must be dead. Not necessarily, right? I mean, they could be, let's be honest, but I doubt it. But it is possible. And OCD says possibility equals probability. And therefore, if something is possible, it is also 100% absolutely highly probable too. Well, that's a problem, isn't it? Right? We just got to be careful with that. And so the other piece of yours there is your fear of dying, your fear of dying in your sleep, maybe even. Here's one thing that I've been saying to people a lot lately is we do all die, right? No one has yet figured out how to escape death. Right? My ask of you is this. Would you like to spend the rest of your life sitting next to your tombstone, wondering when you will be 6 feet under it? Or would you like to spend the rest of your life having a great time and on the day of your death, show up at your tombstone saying, wow, that was fun, and party like a rock star for a good portion of your life? Now, I would like the latter. Here's the deal. Either way, we're going to show up at our tombstone. So we can do it by having a lot of fun up until the day it happens, or we could do it by being miserable up until the day it happens. I choose fun. Personally, that's what I am going to do. I am going to choose fun. I don't know when that day will be for me. And it could be at 8:00 tonight. It is a possibility. I acknowledge that. It could happen. And if it does, well, so be it. I think I've done pretty well. And I'll just go with it, right? OCD says that that's not an option. You must have the answer. And there are just things that we will never have the answer to. We will not know the exact date or time, right? It's just the way that it is. So I hope you live your life. Because remember, OCD does not have your best interest at heart. All right, what do we got next? Can someone form OCD by watching media? I'm not diagnosed, but I have faced a lot of times where I think people are watching me in my own home, flipping down objects when I can, and being away from unblinded windows. Some of the objects would be stuffed animals, and you've gathered this habit by watching Toy Story. I don't want to say that media causes OCD, but I will say this. We know that OCD can be triggered by a stressor. So if this is the stressor for you that leads to some OCD, so be it. But maybe there's some paranoia there that's as well too. Like by watching TV, you've gotten into some conspiracy theories or fears of what ifs of these things that people are out to get you or something like that. My number one piece of advice to you is take this to a trained therapist and let them help you figure out what the diagnosis is so that you do get the best treatment available for yourself, because you don't have to live in fear of these types of things happening. right? Of people watching you in your own home, uh, something like that. So I really do want you to reach out to someone and talk to them about that so that they can get you whatever help is the best help for you. I can't tell if I have high anxiety or if it could just be crossing over into OCD. I'm wanting to look into therapy, but I'm not sure which to look into. If you're really thinking about therapy, let me, not to toot an OCD horn here, but I will a little bit. Uh, we train our therapists to treat OCD and anxiety disorders. So no matter what that diagnosis is, be it anxiety disorder or OCD, we can treat it. And the treatment is very similar. We use exposure and response prevention therapy across the board. The ERP may look different for different presentations, right? That's a possibility. But overall, we can definitely treat it. Right. And so I hope you will consider reaching out and allowing us to maybe see what we can do for you. And remember, our care team is standing by at NOCD.com. So we'd be happy to chat. All right. Would honestly find it very helpful to maybe get some insight on knowing the difference between compulsions, impulsive, intrusive thoughts, and more run-of-the-mill fixations. So I think that this goes to a couple of things about OCD. Number one, we overuse the word obsessed. If you like something, we often have heard people say you're obsessed with that thing, which then could, in the minds of people who don't really know about it, could mean, oh, you must have obsessive compulsive disorder if you're obsessed about something. So like I've seen the band Rush 30 times in concert. Some people have accused me of being a bit obsessed with the band Rush, but I don't have OCD. So I really like Rush. I think they're awesome, but I'm not doing any compulsions around them. So obsessive is really an incorrect term in this situation, right? Maybe we should say, I really, really like Rush. I have a strong like of Rush. I really enjoy going to see their shows and listening to their music. And I've spent a good portion of my life in concerts or, listening to stuff or reading about them. But uh, they're gone now, right? Neil Peart passed away, and there were no compulsions or things I could have done to bring him back. Cancer's an ass, and it's just the way that it is. So I accept that, and I still enjoy listening to their music and watching footage of shows and things of that nature. But that's where it's at. So I'm a stickler for language because I don't really like to use obsessed other than obsessive compulsive disorder. Now, there's also questions about compulsions, right? And compulsions are behaviors done to neutralize obsessions. But sometimes we hear the overuse of the word compulsion, like you're a compulsive eater or a compulsive gambler. I think that's really better described as impulsive eating or impulsive gambling, as in I have this impulse to do something. And when I do it, even though I maybe know it's not great for me, when I do it, I really do get a rush from it. And then I might really dive into it because I really, get that joy out of that experience in the moment, even though I know that it's not a good thing for me. People with OCD do not get a joy out of their obsessions and out of doing their compulsions. They get relief, but they don't get a joy whatsoever. I say this, and why this is important is because, again, I want to make sure that we're using words correctly. So obsessive compulsive disorder. I have intrusive thoughts, images, and urges that I maybe find to be unwanted or inappropriate. And I believe that if I don't do something to neutralize them, something awful or terrible or horrible could potentially happen to myself or somebody else. And I would be responsible for that. And we're going to stick to those definitions. So I use obsession when I'm talking about OCD. I use compulsion when I'm talking about OCD, but I don't use obsession or compulsion about anything other than OCD. I will talk about having impulses to do things, strong desires for things, something of that nature, difficulty stopping doing things. But just because it is hard to stop doing something doesn't mean it's compulsive. Can repetitive thoughts be caused by something other than OCD? Asking for a friend. Well, of course. Uh, When when my wife was diagnosed with cancer, all we thought about was cancer for like a long, long time. And eventually she passed away from the cancer. Our lives were consumed with cancer for 6 years. I didn't have OCD about it, but it was the number one topic in our lives. And so, yes, absolutely. You can talk a lot about something without it having to do anything with OCD whatsoever. I often find myself feeling anxious that people are watching me and thinking I'm acting weird, even though I'm doing nothing weird. What is that? Well, it could be a social anxiety disorder. We see that in social anxiety disorder, a great big deal, where people are very, very afraid of what others are thinking about them. And they have this idea of evaluation in their head, and they believe that others have this very negative view of them in some way. You know, no one with social anxiety disorder has ever come in for treatment and said, I'm really afraid that everybody loves me and thinks I'm awesome. No one with OCD has ever had that fear either, by the way. That's just not the way that it works, right? And so it would not be at all uncommon for that. This sounds very stupid, but sometimes I'll fixate on makeup products. Hey, there's nothing stupid about that. I want to buy and I won't be able to stop thinking about them until I buy them. Is this normal? I have no idea what normal is. So that part I can't really answer for you. But people can feel very pressured about things and really think a lot about things and have that stuck in their head until maybe they make the purchase for something. If this is a problem for you, like you're buying too many things and maybe even getting to a hoarding kind of experience, uh, well, there's help available for that. So if you want to know how to be able to sit with or deal with those thoughts coming into your head and the pressure that you have from them, you can reach out to us at NOCD.com, and I think we could probably assist with that. I'm a psychiatrist who's referred patients to your services. Wanted to ask the average number of ERP sessions, numbers a week it takes to get into remission. My guess is around 12 weeks. Yeah, that is pretty typical. 12 to 15 weeks is not uncommon at all, actually. And that, I think, is a good message for anybody out there listening to this who has OCD, who worries about how long will therapy take, how much time. It can be done really, really fast. We're just talking usually about a couple of months, and then we can get people into more of a maintenance level of treatment. Now, I've had people who I've seen for years and years and years, but I don't see them once a week. I might see them once a month. I might see them once every 2 months. I might see them once every 3 months. That's the farthest that we'll go out to people because we like to just have a quarterly check-in at least. But isn't it great to know that you've got somebody in your back pocket who knows you well and that you can reach out to at any time? And one of the nice things about NoCD is we have a messaging ability on our NoCD app. So even between sessions, you can have a connection with your therapist, which is really cool. I read NoCD treats other related issues to OCD. Yes, we do. I feel like I have obsessive thoughts that ruin my days, and I read into situations far more than normal. And I even logically know I'm overthinking, but my brain convinces me my thoughts are for sure true. I've always just called it overthinking. I'm not sure if I have any compulsion, so can NoCD help? Yes, we'd be happy to do an evaluation because there could very well be mental compulsions that you're doing. Most people don't catch those very well, but we can do that. So we can help you see if there's any mental compulsions that might be going on. I'm terrified of exposure therapy, especially with things that you consider dirty or unclean and physically can't imagine putting yourself in certain situations. How would treatment look, and do all of the treatments use this kind of therapy? Well, we do this kind of therapy. And here's the reason why. I haven't figured out yet how to help people overcome the fear of something without engaging in it, right? So if you came in and said to me, I have a fear of getting on elevators, do you think we'd probably have to practice on elevators at some point? Because if all we did was talk about elevators and then you said, okay, great, I'm not afraid of elevators anymore. And then I said, awesome, let's go get on an elevator. And you're like, oh, I mean, no, I would never get on one. I'm not afraid of them anymore, but I would never get on one. That wouldn't make much sense, would it? I just don't see that being something very logical in that situation. So, um, what may feel overwhelming right now about being clean or dirty doesn't have to mean that it will be overwhelming to you, right? I believe that you would be able to handle any ERP situation that would come up, even if your brain tells you that that would not be the case. And I hope that you might give us or someone the opportunity to assist you with that, to learn that that's actually the way that it works. I'm worried that OCD treatment will be traumatic and scary. How can I be assured that it will work for you? Well, my goal is never to have it be traumatic and scary. I mean, we create a hierarchy with people, and the beauty of the hierarchy creation is I do it in conjunction with the people I'm working with. I don't do any surprises with people until later on in therapy, and they've agreed to do some surprises. And why would we ever want to do surprises in therapy, by the way? Oh, because life throws surprises at us, and therefore, wouldn't it be great to know that we can handle those and be prepped for that? So yes, but please know this, that we are not here to scare you away with ERP. That would be really dumb. Actually, it'd be a terrible therapy model. I mean, if that was the case, I'd probably only see people for 1 or 2 sessions, and I'd be like, why doesn't anyone ever come back? Oh, because you're scaring the crap out of them. Well, not anything that I want to do whatsoever. So I believe ERP can be very helpful for people, and it's a good collaborative treatment to do. Next question. I've been struggling so much with thoughts about my relationship, even if everything is literally going amazing. I can't get out of my head thoughts about his ex from 3 years ago he has no contact with. Anyone else he's ever been with, if he wants a future with me. Just so many thoughts that send me into spirals. I feel like I can't control them at all. Well, boy, this stinks. I mean, I hate that we have these kinds of things coming into our head, and it just really feels like it's ruining a relationship. Here's the deal, though. We can't change the past of anybody, right? And OCD logically knows that, but emotionally will always say, yeah, but what if they were better in bed than you? What if they were cuter than you? What if they think about them? Uh, you know, are we really sure that they're not in contact with each other anymore? All of these kinds of things, right? And it can get so overwhelming for people, of course, right? Because we stay so very stuck in these situations, and we believe our thoughts to be the truth. So if your partner has said they're not thinking about their ex whatsoever, and you believe them, you bringing their ex up and asking them about it will lead them to think about their ex. Now, isn't this a paradoxically interesting thing? I don't think about my exes until somebody asks me about them. And if I were dating somebody with relationship OCD who was very worried about my exes, and all they did was bring up my exes, guess what I think about all the time? My exes. And now OCD will be like, see, they're thinking about their exes. Oh my gosh, look at this. Why are they thinking about their exes? Because you keep bringing them up. How could I think of anything but that if that's the case? So this is a trick of OCD. And here's the trick. If I can get you to think about these things, then I can get you to do compulsions. And guess what OCD eats for breakfast, lunch, and dinner? It eats compulsions for breakfast, lunch, and dinner. If you don't do compulsions, OCD fades away. Guess what OCD does not want to do? OCD does not want to fade away. And therefore, whatever it can do to get you a compulsion, it will do. Even at the expense of your own relationship. Because remember, OCD does not have your best interest at heart whatsoever. It has its own interest at heart. And even if your relationship were to break up, guess what's not going to take responsibility for that? OCD. OCD is not going to be like, oh, I'm so sorry. My bad. I apologize. Nope, that's not what's going to happen. OCD is going to be like, well, you really screwed that one up. There's another one. Look what you did. If you had just, gotten everything figured out right, everything would have been okay. But no, you don't know how to do that. And boy, maybe the next time will be the time. OCD has never once taken responsibility for anything. Okay. OCD's an ass. OCD needs to go away. All right, one more. So you want to know more about how OCD and PTSD interact? Well, one way to think about it is this. If you've had some kind of traumatic experience happen in your life, OCD, being the opportunistic jerk of a disorder that it is, will say, hey, guess what? I can prevent that from happening ever again. And you know the best way that I can prevent that from happening is? I'll tell you, by having you do compulsions. Compulsions stop bad things from happening. That is the lie that OCD tells someone, and therefore why it wouldn't be unheard of for somebody with OCD and PTSD to see a rise in OCD, or for OCD to come in after the PTSD, being again that opportunistic thing that it is, and saying, I've got the solution to help you. Right? Here's the good piece. Both are treatable. And therefore, you don't have to suffer from them, which is awesome. Well, I hope that that's been helpful. It's been nice spending some time with you, answering some questions, and my best to you all. If you are looking for help for OCD or related conditions, and you want expert therapists who can help you with the treatment of those things, check us out at NOCD.com. That's NOCD.com. Thanks for watching. We'll see you again soon.